We're taking the rest of the time right now to have them answer your questions, and you can text them to that number, 336-379-5775. Again, it is text only, do not call. All right, this person is asking, is there a booster to the vaccine to combat the variant that we're hearing about today?
Yeah, I'll take that. They're working on one, actually, especially to some of the variants that might have the potential to evade the antibody response. So maybe that will need to be boosted, kind of like we have to be for a lot of other adult vaccines. But more to come on that one.
So now the UK variant is found in Guilford County. Is it any more contagious or deadly, and could that change as time goes on? Dr. Parrott?
So I don't know that we have an answer for what will happen in the future. COVID is new to all of us still. It's been around for just a few months now, almost a year in this country, and we learn more and more every day. I think the key is, no matter how infectious it is, if we continue to wash our hands, wear masks, and socially distance, will help to keep ourselves safe.
Right, and that is the way to keep it from spreading here, those 3 W's that you were talking about. Dr. Brooks, someone is asking, health experts say the vaccine is still likely to be effective against this variant, but how long before it changes? Do we know that either?
Yeah, there's a lot that we just don't know yet, and time will tell as we learn more.
Okay, so this is a Cone Health question. Dr. Brooks, will the people who were canceled this week at Cone be automatically rescheduled?
Yes, so they will receive an email or a phone call from someone within Cone Health who will reschedule those appointments for them.
Okay, Dr. Parrott, this person is asking, do I have an option of which vaccine I receive, Pfizer or Moderna?
So we will give the vaccine that we have at the site on that day. So there's not a choice, unfortunately. And like Dr. Ohl said, both vaccines are effective equally.
Okay. This person is asking about, of the vaccines given so far, do you know what the percentage of those are people of minorities? Dr. Ohl, I know you were talking about that you have several events even coming up focused on that.
Yeah, so, I think I can speak for Forsyth County, and for memory, it's about 10% so far have been minority patients. And that's just not good enough. We need to get those numbers up. So we're working on outreach. All the health systems are, and cooperating together in order to do this. And the first step is communication, answering people's questions, making them feel less anxious about it. And then the second thing is getting them access to getting vaccinated.
Okay, quickly, we have about less than a minute. Dr. Parrott, what are the most common side effects linked to the vaccine?
So, like we've said before, you can definitely have a sore arm, you might have a headache, you might even have a fever. The second vaccine can be a little worse than the first vaccine, but there are lots of people that feel just fine.
Mm-hmm. And I think you would all nod your head in unison when I say, do we all have to wear our masks after we get the vaccine? Yes, yes, we do. Yes. Thank you so much. All right. Thank you for joining us today. And thank you for bringing in your questions. If you missed anything, you want to share something that was mentioned today, we posted all of these segments and the appointment process information on our website. Look for WFMYnews2.com, joining together for COVID-19 vaccine education.